Problems with brachycephalic dogs with their breathing are very, very common, and it's a breed-related issue that raises a whole other area of discussion. The problems are so common, and we can fix the majority of them with early intervention. And if you delay, then you can have progression of the syndrome to the point that surgery is actually not an option, or at least doesn't totally resolve the clinical signs. And so it's one of those situations where early intervention can result in marked improvement in quality of life, and it can also prevent progression of the condition, and the progression can be basically non-treatable. And so it's important to get in early and fix these things. The first step, I think, is getting good technical and clinical instruction, so that you can have a really big head start, because there's a learning curve with any one of these procedures. But when you have the opportunity to do the procedure a few times on a cadaver with experts in the field watching over you and pointing out mistakes and pitfalls that you might run into, you're way ahead on the curve. And so I did a residency program, and that's where I learned how to do them, where I had instructors that were watching over my shoulder as I did the procedure. And so having that, that supervision and that safety net early on is really, really important. If you're going to start doing these in primary care practice, it's probably a good idea to do the less severely clinically affected animals early on, because they're the ones that are less likely to have the problems post-operatively before you go on and tackle the more severely affected patients.